Here at EHA, we presented the interim results from our open-label phase 2 Beacon trial. This is an open-label trial of 20 and 60 milligrams of Bitopertin in people with EPP in Australia. And we presented results on 15 patients. And because it's an interim look, they have varying degrees of completion over time. But what our results show is that we reduce protoporphyrin 9 by, in both dose groups by 30%. And the 30% threshold is important because there are publications in the literature that suggests that if you can reduce protoporphyrin 9 by 30% or greater, that there is the potential for full remission or near full remission of light sensitivity. And so with that 30% plus reduction that we saw in the trial, by a number of measures of light tolerance, we actually saw vastly improved light tolerance. So the measures that we looked at, first of all, was a weekly sunlight challenge where patients go out in sunlight and measure how much time it takes to get what's called a prodrome or early warning symptoms of a full phototoxic reaction that these patients get. And these full phototoxic reactions can be aborted if the person extracts themselves from sunlight, and you can clock the time from when they went into sunlight till when they felt the premonition that a full reaction was about to come on. And what we saw was a many-fold increase over the course of the study in the ability to stay out in sunlight until patients felt that time to prodrome. And on aggregate measures of light tolerance, looking at the number of minutes per week compared to a baseline period versus on study, we saw also a many-fold increase in the number of total minutes able to be spent outside. And then on looking at the rate of the full phototoxic reactions, we saw a 96% reduction in the rate of those reactions compared to the baseline screening period.